In the study that we performed this time with a collaboration with the European Bone Marrow Transplantation Society, we tried to ask the question if in 2022, using more advanced statistical methodology such as AI-based method, and I refer to machine learning methods and also deep learning algorithms, it is possible to improve the risk of death and also risk of non-relapse mortality for the patient receiving allogeneic stem cell transplantation. In this study, we collected the data of almost 50,000 patients from the registry. All the patients were adult patients affected by the most prevalent type of blood cancers, that referring to myeloid diseases, lymphoma, and non-Hodgkin and Hodgkin lymphoma, and also plasma cell dyscrasias. In our study, we tried to consider all the variables which had a prognostic factor, which was already known by the transplant community. However, what we show is that even using this AI-based methodology, the advantage over a multivariate logistic regression was not so great, but also the area under the curve and the C-index of all these new scores were not better than logistic regression. And in absolute terms, the C-index of this type of test was poor, in the sense that it ranges from 0.57 up to 0.64, which means that also trying to use this AI-based methodology, we didn't improve our risk of stratification and prognosis for our patient. So the conclusion of this study is that maybe, of course, AI methodology represents a very powerful tool today and in the future to stratify patients. However, the quality of the data and the type of the data that we are using is fundamental. Otherwise, this algorithm won't improve anything. In this case, the EBNT registry has a lot of clinical significant variables, but maybe they're not sufficient to improve our capacity to predict the risk of death of such patient and their overall mortality. Maybe in the future that would be ideal to use and integrate clinical variables with biological variables, and also maybe a dynamic evaluation of such factors, not just in one time point. And that is probably the way where we should go in the next years.